and welcome to all our listeners to an exciting episode of the MedGate Today podcast, where we bring you the most insightful conversation from business perspective in the world of healthcare, pharmaceutical, diagnostics, and medical device advancements. In today's podcast, we have Dr. Raju Vaishya. He is the Senior Consultant, Orthopaedic and Joint Replacement Surgeon at Indraprastha Apollo Hospital, New Delhi. Hello, sir. It's our pleasure to have you in-house at MedGate Today studio.
Thank you for this opportunity and hosting me today.
Sir, it's our pleasure to have such a dignitary personality over here. And first of all, congratulations for winning the most promising orthopedic surgeon of the year at MedGate Today Awards.
Thank you very much.
Sir, how are you feeling after getting this prestigious award?
I am feeling elated having been recognized for this prestigious award for my contribution to orthopedics and research.
And it's our pleasure to have such kind of dignitary personality to give a gratitude who is doing a lot for the society, for the people of India. And I hope you have a vision for doing your contribution to the globe.
I'm sure.
So, sir, as you are a senior consultant in orthopedic, we know that in older people, we always have some kind of orthopedic deficiency. But nowadays, knee pain, bone joint pain, and a lot of this kind of things are happening in younger age. So what is the reason behind this? And what are main focus region due to which these young people are destroying their physical health in terms of bone?
You see, you are absolutely right. Nowadays, we are seeing bone and joint related problems in young people, especially as early as 25, 30 years of age.
Exactly.
The main reason is our lifestyle and their occupational responsibilities. Most people, younger people, do not have adequate time, or at least do not find time or give time for themselves, for their health.
Yes.
So they lack exercise, they put on extra weight, they are on the desk job for hours together, sitting, putting a lot of stress on their back, neck, and knee especially,
yes,
and also the hand using computers. In addition, they also put a lot of stress on their eye because they are in front of screen of computer or laptops or
yes, or iPad and all the electronic things.
Correct. Yeah. So all these things are unnatural.
Yes, true.
And these are all occupational hazard, and these are also known as CRI, that is computer related injuries.
Okay.
And when somebody joins a job which requires such tasks, they must be actually educated how to prevent these injuries, how to avoid these injuries, how long should they sit for one stretch,
yes,
and what can they do to overcome this. And if they do that, they can prevent, or they can at least reduce the problems that they otherwise might face in future. And I've seen a lot of people having chronic neck pain, back pain, and knee pain especially related to these.
So neck pain, knee pain, can it become a chronic diseases?
Yes.
How can you please explain for our audiences?
Our body is meant for walking and climbing trees, our ancestors used to do. It was never meant to be sitting in right angle position for long duration of time. And this is a recent phenomenon that has happened in last few decades. And since our body demands different type of posture, different type of exercise, and if we don't do that, you put a lot of stress on the neck, lower back, and knees especially, yes, and also the hand and wrist. And you face the problem of repetitive stress injuries, RSI.
Yes.
So if you put abnormal stress repeatedly on one part of the joint or tendon or muscle, it gets fatigued, it gets inflamed, and you get into chronic problem.
Oh my goodness. So first time I'm hearing that these kind of knee pain, joint pain can become a chronic diseases. So it's better to do not have a sedentary lifestyle, which is mean like lack of physical activity, on desk job, and a lot of screen time. So I would suggest my viewers to please act smart, and it's a high time to please do not take your health as a gesture of granted thing, because as sir said that human being is meant for movement, so we can have a movement in a small period of time so that our body can be in the movement and the sedentary lifestyle can be reduced, and the pain, knee pain or any kind of orthopedic things can be eradicated from your lifestyle. So sir, we know one term, that is arthritis. What is this? Because in the layman's society, everyone says that arthritis is just a pain. But I think it is more than a pain. So what is it?
Arthritis literally means chronic joint pains. If somebody is having persistent pain for more than few weeks, let's say 4 to 6 weeks in a joint, he may be having early arthritis or advanced arthritis, depending on the duration of the arthritis. In arthritis, basically it's a disease of joint where joint surfaces get roughened. Normally, joint surfaces are very smooth, gliding, frictionless. And if they become rough, you get noises coming from the joint because bones are rubbing against each other. There is pain, there may be deformity, there may be difficulty in getting up. For example, if you have arthritis of the knee from chair, from ground, walking upstairs, coming downstairs, and all those things are indication of arthritis.
Okay. And sir, in arthritis, there is one term, osteoarthritis. So I would like for my listeners to let from you that what is it, how it happens, and most importantly, it happens in the older age. So what can the elderly people do to make a solution for their lifestyle?
There are almost 100 types of arthritis known.
Okay.
Out of these 100 arthritis, the most common arthritis is osteoarthritis.
Exactly.
That is a wear and tear of the joint, and usually it is age related, or at least used to be age related. But now we are seeing osteoarthritis happening in middle age and younger age also.
Is it due to the sedentary lifestyle you mentioned?
Yes.
Okay.
Yeah, sedentary lifestyle, our bad daily living habits, increasing obesity, vitamin D deficiency, and all these, smoking.
Smoking is I think the apex reason why nowadays younger youth is having this kind of deficiency.
Correct. So these are the main reasons why we are seeing more of osteoarthritis. In osteoarthritis, there is wear and tear of the joint. Joint surfaces get roughened, as I said, and the bones rub against each other. They're cushioning of the end of the bone, which is normally very smooth, lined by a tissue called articular cartilage, which is very smooth, gets rough or eroded, and then the joints get damaged. If it progresses further, one may develop deformity of the knee of that particular joint. Like in knee joint, commonly you see patients having bow legs because of deformity.
Bow leg.
In spine, they may get kyphotic deformity, that is bending of the knee, stooping forward. In the neck, they may have difficulty in movement. Driving car, looking at the back, and all those things can happen.
And sir, what is the reason of having orthopedic deficiency in the infants? Nowadays, when a child born, they are coming up with such kind of diseases. So what is the reason?
See, children having musculoskeletal or bone or joint related problem could be due to congenital deformities or congenital problem, means they are born with it because of some problem related to genetics, to their parent history and so on. So there are several diseases which are genetic in origin. Several childhood diseases are developmental, means as the child grows in the early age, they have even up to cancer of bone is not uncommon in children. Dysplasias, muscular dystrophies, these are very dangerous and life-threatening conditions that unfortunately some children have.
Yeah.
Then they may have deficiency diseases like vitamin D deficiency is very common in children, and it is known as rickets. If somebody has
Yes, we know this term as rickets.
They may have difficulty in walking, they limp, they have difficulty in getting up from floor, they have difficulty in playing, and ultimately they develop deformity, which may be knocked knee, for example, or bow deformity of the knee.
And this lead to late movement, like every child start walking in 1 year, 1.5 year, but due to deficiency, they have this a very late in their life.
In medical term, it is called delaying in the milestone.
Okay.
They have delayed milestone.
Exactly. It's a milestone. When a kid start walking, the parent joyness is out of the world, because they know like our kid has started walking now,